Well, erectile dysfunction is the inability to get, maintain, or keep an erection satisfactory for intercourse. So it just has to do with the mechanical erection. It doesn't have anything to do with ejaculation or orgasm. So erectile dysfunction is actually very common. The rate of erectile dysfunction increases significantly the older you get, but we do see this in people as young as 20, 30 years old. Sometimes it's related to pre-existing conditions or trauma or diabetes that can come on at an early age. And then as you get older, we tend to see vascular disease associated with worsening erectile dysfunctions. Sometimes we even see it after radical surgery for cancer or other reasons. When you look at the causes of erectile dysfunction, you really need to understand how an erection works. So you have to have hormones, so you have to want to have sexual activity. The nerves have to be intact. The blood vessels have to be good. And then you have to be able to keep or trap the blood in the penis to maintain a hard, rigid erection. If any of those things break down, then you can have erectile dysfunction. If you look at the arteries, you can have vascular disease, whether it's from plaques building up in the arteries. That same thing that happens in your heart as you get older, or sometimes trauma or surgery can damage those arteries. The nerves can be damaged by things like diabetes, trauma, or surgery. You can have low testosterone or antidepressants that may affect your sex drive, or certain conditions like scar tissue, penile curvature, are associated with venous leaks that cause you not to be able to keep the blood in the penis and have erectile dysfunction. There are several ways to diagnose erectile dysfunction. Number one is by clinical history. Basically, we ask you questions, you tell us, yeah, I have had difficulty getting and maintaining erections. We look at other possible pre-existing health conditions that may be contributing to this. Sometimes we'll give you a trial of medication like Viagra or Cialis to see if that improves blood flow and helps with the erectile dysfunction. For more advanced conditions or severe ED, we do things like a penile Doppler ultrasound where we give you a medication to stimulate an erection, and then we use ultrasound to look at the blood flow and help further diagnose the problem. So can erectile dysfunction be prevented? Well, the number one thing is just overall good health. So think about men's health. When you think about weight loss or weight control, okay? Being overweight is going to put you at risk for things like diabetes. If you have diabetes, you want to maintain strict glucose control, have a good hemoglobin A1C that prevents nerve damage. Cardiovascular exercise, anything that's good for your heart is going to be helpful in preventing erectile dysfunction. So many providers are capable of treating erectile dysfunction, whether it's a primary care physician, family practice doctor, nurse practitioner, but there are some advantages of seeing a specialist. So, we're going to know really quickly whether or not you need to go on to that second, third line treatment option or testing. Certainly after you've tried pills like Viagra or Cialis, we don't want to keep throwing more medications at you. It's nice to see a specialist, get to the root of the problem, and get you a good solution. One example may be radical pelvic surgery. If you had your prostate out and the nerves were damaged, all the Viagra in the world may not cure your erectile dysfunction. We don't want you to have to waste years dealing with treatment options that are not going to be of benefit. So in that case or scenario, it's much better to see that specialist early to get the problem solved. So when we look at treatment options for erectile dysfunction, we like to look at it from least invasive to more invasive. So number one would be the vacuum erection device. So this is a pump that goes over the penis, negative pressure sucks blood into the penis, and then there's a tight band at the base of the penis that's going to trap the blood in. Next are going to be the pills, things like Viagra, Cialis. Those work by dilating blood vessels right where the nerves attach to the penis to increase blood flow in an erection. There's penile injection treatment. So if you have nerve damage, we can bypass those nerves by injecting medication directly into the penis to help stimulate an erection. Also, there are pills or liquid gels that could be inserted into the urethra, the opening on the penis that you urinate through, and it's absorbed similar to a shot. You're putting the medicine right into the penis to get an erection. And then there's surgery, such as a penile implant, that allows you to have that spontaneity, not have to worry about pills or injections, and be able to get an erection whenever you want. So in order to determine which erectile dysfunction treatment is right for you, we're going to have a conversation with you and your partner and look at what your goals are. Some people have different goals. Some people want the least invasive treatment. Some people want to just fix the problem, never have to worry about it again, have that spontaneity they had when they were younger, be able to have sexual activity wherever they go, whether it's going on vacation, camping, out in the middle of nowhere. So we're going to talk to you and individualize your treatment options. But certainly we're going to look at your history, surgeries, what you failed before, and get the option that's right for you. Some people, even if the penile injections work, they want an implant. They don't want to have to deal with that. Sometimes even medications cause severe headache and side effects, even though they work. They don't want to have to deal with that. They just want to be able to have satisfactory intercourse whenever they want and not have to worry about the headache of carrying medications around or remembering to administer those medications or deal with those side effects before they want to have sexual activity. So when you look at the satisfaction rates for the different treatment options, it's kind of hard to put an exact number on it, but I can tell you things like the vacuum erection device tend to have a very high dropout rate. It's not very natural, it's not very spontaneous. You've got this tight ring constricting the base of the penis. It may go numb, be uncomfortable, so people tend to get discouraged easily with that. With the pills, if you don't have a bad headache or side effect, that works very well. That may have a high satisfaction rate in the beginning. However, as things progress, or certainly if the pills are no longer effective, then people are going to be looking for other options. Injections, you really got to have the right person. Somebody that has a long-term partner, they don't have sex very often, it's once a month, they're going to plan for it, they're going to go give themselves an injection, and it works for them. They're okay with that. But for the other guys that want to be able to have it whenever they want, not going to want to have to worry about the injection or risk of a prolonged erection or some of those side effects, that may not be the right option for them. And then when you look at the implant, we see a very high patient and partner satisfaction rate into the mid to upper 90s with the device. So are there any long-term consequences from not getting erections? Well, in fact, there are. And we see that in guys that have had radical prostate surgery and weren't really told that they needed to do rehabilitation or start on a program for their erectile dysfunction afterwards. Because what happens if you don't have those daily erections that increase blood flow, basically the penis has a low blood flow or ischemic state all the time. And then you get complications like scar tissue, you lose length, develop curvature of the penis. All that is increased when you don't have that normal blood flow and those spontaneous daily erections. That's why we use things like the vacuum erection device after radical prostatectomy or other surgeries that can affect the erections to help stimulate return of blood flow, even if you know that eventually you're going to go on to have an implant or need some other type of therapy. So it's actually very important. And it's amazing now, I've seen guys 1 to 2 years out that have had no erections and didn't know there could be consequences of this.